Hello everyone, I'm Dr. Ala Musbah, Professor of Obstetrics and Gynecology, Faculty of Medicine, Mansoura University. The topic of my lecture today about emergency contraception. So what we want to discuss today, the definition of emergency contraception, the indications, what are the methods for emergency contraception, and when to start using emergency contraception, what is the most effective method. Okay, let us start with the definition. Emergency contraception is the intervention that allows women to avoid unintended pregnancy after unprotected intercourse. Okay, so this is as regard the definition, and this is in the picture different methods used in emergency contraception, like ulipristal, one tablet here, like copper T, ID insertion, like levonorgestrel, 2 tablets within 12 hours apart, like COC. So these are different methods of contraception, and let us know what it is and when it is given and so on. Okay, what about the risk of pregnancy after unprotected intercourse? The overall risk of pregnancy is 5.6%. Okay, and this in case the patient, the woman, has an unprotected intercourse and she didn't use emergency contraceptive treatment. Okay, but this risk of pregnancy increase to 30% during the fertile period. So what is the fertile period? The fertile period in each cycle, 5 days before and the day after ovulation. Why? I said 5 days before and the day after ovulation. Because the sperm can survive and remain fertile for up to 5 days. Okay? While the oocyte stay fertile for 24 hours only. That's why I said 5 days before and the day after ovulation. Okay? Okay, what is the indication for emergency contraception? 3 categories of women as a backup or as a backup method, or for prevention of pregnancy in absence of any form of contraception usage, or in sexual assault victims to avoid potential pregnancy. What about as a backup method? Emergency contraception used as a backup method. As all of us know, there may be a missed pill for those who are using COC pills, for example, or delay in the boot shot, or the woman using implant but it is expired right now. Okay, or there is use of condom and there is a break in condom during intercourse, so I need a backup method. This backup method is the emergency contraception. Okay, so the indication of emergency contraception as a backup method, as I said, or for prevention of pregnancy in absence of any form of contraceptive usage, or in case in sexual assault victims to avoid potential pregnancy. Okay? Okay. So let us go to the very important items, which is the methods for emergency contraception. The recommendation from the American College and from WHO. First, the ulipristal acetate. Ulipristal acetate, as you see in this picture, it's called ELA in some countries. It is 1 tablet only, 30 milligram. What is ulipristal acetate belong to which group? This is a selective progesterone receptor modulator. Okay, and this is one of the most commonly used emergency contraception with a high success rate. This is ulipristal acetate, single dose, 30 milligram. Other methods for contraception combined COC, combined oral pills. Okay, in two doses 12 hours apart. Okay, but you should know that each dose should contain 100 microgram ethinyl and 0.5 milligram levonorgestrel. So if we are using COC with high dose pills containing 50 microgram and 0.25 milligram levonorgestrel, so the patient should take 2 tablets of this high dose, and after 12 hours she will take another 2 tablets. Of course, one of the side effects is the nausea, vomiting, headache, and so on. Okay. What is next? Levonorgestrel only. And levonorgestrel only tablet is less side effect than combined COC. Also given in 2 doses, each one 0.75 milligram between the 2 doses 12 hours apart. Okay, as what is called contraplan, as you see in this picture, 2 tablets 12 hours apart, each one contain 0.75 milligram levonorgestrel. Okay, some recommend to give the 2 doses at the same time, 2 tablets at the same time, but to lower the side effects you can give it after in the 2 doses, 1 tablet then another tablet after 12 hours. All both regimens can be prescribed by different gynecologists. Okay, let us go to the next, the copper AD. Yes, it should be made available to women for up to 5 days after unprotected sexual intercourse when requested. Okay, so copper ID also can be given. So we have different variables here: ulipristal acetate 30 milligram, combined estrogen and progesterone pills in 2 doses 12 hours apart, but each dose should be 100 microgram estradiol and 0.5 milligram levonorgestrel. The third choice is levonorgestrel only tablet, available in 2 doses, each one 0.75 milligram, 12 hours apart. Okay, then the copper ID can be inserted at any time within 5 days of unprotected intercourse. Okay, so when to start? Yes, of course, it is very important to start as soon as possible after unprotected intercourse. Okay, as soon as possible, because the success rate to prevent pregnancy is higher. Okay, okay. You should know that if the patient came late, what is the suitable emergency contraception? The suitable one is copper TID and ulipristal acetate. Okay, copper TID and ulipristal acetate. Okay, ulipristal single tablet, as I said before, 30 milligram. Okay, given in 1 dose, or insertion of copper ID. Both of them can be given to the patient who came late after the first 72 hours. While the COC and the levonorgestrel only tablet, like Contraplan, should be given within the first 72 hours and as soon as possible, as I said before, to have a success rate, higher success rate. Okay, okay. So if she came after the 72 hours, I have these 2 choices. Okay, copper ID insertion or ulipristal acetate. So what is the most effective method? Really, the copper ID is the most effective. It prevents pregnancy in 99% of the cases, as if as compared to Ulipristal, which carries success rate of 85%. Okay, it prevent pregnancy in 85%. So ulipristal 85, copper T 99%. Okay, okay. What about the combined pills, COC? The combined pills 75% in prevention of pregnancy, while the levonorgestrel only, like contraplan, the 2 tablet, is 70%. So again, 99% for copper T, 85% for ulipristal, 75% for COC, 70% for levonorgestrel. This is as regard the most effective method. This is the last slide. I hope you understand this topic very well, and I recommend my 2 textbook of obstetrics and gynecology, which is available on Amazon. Also, in textbook of gynecology, there is chapter about contraceptive methods. You can read more about contraception in general in textbook of gynecology. Thank you. I'm Dr. Ala Misbah, Professor of Obstetrics and Gynecology, Faculty of Medicine, Mansoura University.